Tetanus by Alexandria Cordova, Lisette Loera, and Evelyn Rodriguez. The history of the tetanus vaccine. The vaccine was first researched with animals in 1884. Early scientists examined cadavers of those infected to further the study of tetanus and its deadly effects. Tetanus toxoid was developed in 1924. Scientists found the organism responsible and contained it for the development of a treatment. Initially, the vaccine was widely used in World War II. Soldiers often contracted tetanus through their soiled injuries, but with the vaccination, the infection rate decreased. In the United States, before the vaccine, tetanus caused 500 to 600 deaths per year. Deaths are reduced to less than 100 per year, along with widespread vaccination for every life stage. Today, the vaccine has reduced deaths to less than 1% per year. What is tetanus? Tetanus is caused by the bacteria Clostridium tetani, which is found in soil, dust, and manure. Tetanus enters the body via open wounds, such as cuts, punctures, burns, and even the umbilical cord. Is tetanus contagious? No, it is not. Tetanus cannot be spread from person to person. Tetanus symptoms include lockjaw, such as tightening of jaw muscles, sudden involuntary muscle spasms, painful muscle stiffness all over the body, trouble swallowing, seizures, headache, fever and sweating, changes in blood pressure and heart rate. Symptoms appear between 3 to 21 days. Tetanus can lead to death. 1 to 2 in 10 cases are fatal.
Who can get the tetanus vaccine? The tetanus vaccine is given alongside pertussis and diphtheria. For young children, they are given the DTaP vaccine, whereas preteens and adults are given the Tdap vaccine. Young children are expected to get 5 shots. Shot 1 is given at 2 months, shot 2 at 4 months, shot 3 at 6 months, and shot 4 between 15 and 18 months. Shot 5 is given between 4 and 6 years. Ideally, in preteens, the first Tdap shot is given between 11 and 12 years. If not given the shot between this time frame, teenagers should receive it at their next doctor's appointment. Adults are expected to get another booster shot every 10 years in order to maintain immunity. Maternal and neonatal tetanus, also known as MNT, is a type of tetanus caused from unclean deliveries and umbilical cord practices. Strategies to fight against this are providing Tdap shot to boost pregnant mothers during the 3rd trimester, having sterile birthing environments, providing the first 3 vaccination shots for free or reduced cost, and strengthening neonatal tetanus surveillance. Barriers to MNT elimination include treatment costs, long distances to healthcare facilities, and for some countries, women need permission from their husbands for medical care. So far, maternal and neonatal tetanus elimination targeted 59 high-risk countries. 21 countries have not yet eliminated maternal and neonatal tetanus in 2019.
Vaccine data. Our World in Data has compiled data over the past 3 decades, significant fall in the number of deaths from tetanus globally. This can be seen in the graph provided. In 1990, 314,000 people died due to tetanus, while in 2019, there were less than 35,000 deaths. That's an 87% reduction. Who it protects? Effective on nearly 97 out of 100 individuals against diphtheria. Everyone is protected for at least 10 years. Children who get all 5 doses within the year following the last dose. The efficacy the first 10 years after getting it, when women get Tdap during pregnancy, more than 3 in 4 babies younger than 2 months old from getting a whooping cough. Complications from vaccine is extremely rare. The disease itself possesses far more risk than the vaccine.
Question time. Tetanus vaccine is given along with what other 2 vaccines? Is it A, polio and smallpox, B, pertussis and diphtheria, C, pertussis and smallpox, or D, pneumococcal and diphtheria? And the answer is B, pertussis and diphtheria. Recall that tetanus, pertussis, and diphtheria are given together as Tdap or DTaP vaccines.
Patient education. Don't forget to get your booster shot every 10 years. For parents or guardians, ensure that your babies get their first 3 shots before the age of 1. Your children should get a total of 5 shots before the age of 10. How to engage the community? Recruiting the help of local business, trusted community leaders, and clergy members to combat vaccination hesitancy among the general population. Hospital-sponsored health fairs, educational programs, reaching out to schools to give information to the students.
And here are our references. And have a good day. Let's stop the recording.